Good day everyone, I am Micaela Miches Diva, BSN 12, your student nurse for today's return demonstration about respiration rate taking. The purpose of this demonstration is to provide valuable information about our patient's physical and emotional health. So in procedure number 1, we will going to wash our hands to reduce the transmission of microorganisms. After washing your hands, we will proceed to procedure number 2. It is to identify and explain the procedure to the patient. It is to perform the procedure to the right client and to alleviate fear and anxiety to promote cooperation. So ma'am, good morning. I am Micaela, your student nurse for today. I am going to check your respiratory rate. Is that okay with you, ma'am?
Yes, ma'am.
Will you cooperate during our activity?
Yes, I will cooperate.
Thank you. So we will proceed to procedure number 3. Hold the client's wrist just as if you taking her pulse. In this way, the patient is not conscious while breathing is being watched. So in procedure number 4, note the rise and fall of the client's chest with each respiration. Complete cycle of inspiration and expiration constitutes one act of respiration. In procedure number 5, we will going to use a watch with the second hand. Count the number of respirations for 1 full minute. Sufficient time to observe depth and the other characteristic is necessary. So in procedure number 6, after we take her respiratory rate, we're going to wash your hands for infection control measures. Okay, so after washing your hands, we will going to record the number of respirations to serve as a baseline data. Okay, so after we finish checking her respiratory rate, let us proceed on checking her pulse rate. So the purpose of this is to provide clinical data regarding the heart's pumping action and the adequacy of peripheral artery blood flow. So the equipment that we are going to use is the wristwatch and alcohol-based pen drill. Let's start our demonstration. So in procedure number 1, we will go to wash your hands to reduce the transmission of microorganisms. Okay, so after we wash your hands, we will going to proceed to procedure number 2. It is to identify the patient and explain the procedure. It is to perform the procedure to the right client and to alleviate fear and anxiety. So ma'am, good morning again. I am Micaela, your student nurse for today. I am going to check your pulse rate. Is that okay with you, ma'am?
Yes, ma'am.
Okay, will you cooperate during our activity?
Yes, I will cooperate.
Okay, ma'am. Thank you. So in procedure number 3, have the patient rest her arm alongside of her body with the wrist extended and the palm of the hand downward. This position places the radial artery on the inner aspect of the patient's wrist. In procedure number 4, we were going to place the tips of your midline 3 fingers on the palm side of the patient's wrist. Fingertips are sensitive to touch and will feel the pulsation of the patient's wrist. In procedure number 5, we will going to apply enough pressure so that I can feel the pulse, not too hard and not too light. Too little pressure will be imperceptible. Too little pressure is imperceptible, and pressing too hard may stop the flow of the blood and you will not be able to feel the pulse. Okay, so procedure number 6, we will going to use watch with second hand count the number of pulsation felt on the patient for 1 full minute. Sufficient time is necessary to detect irregularities and abnormalities. Okay, ma'am, thank you. So in procedure number 8, we will going to wash your hands for infection control measures. So after washing your hands, we will going to proceed to procedure number 9. It is to record the result in a graphing sheet to serve as the baseline data for healthcare providers. So that's all for respiration and pulse rate taking. Thank you for watching.